Colorado is amongst the worst in the nation when it comes to people getting lung cancer screenings. In fact, Colorado ranks 40th amongst all states for lung cancer screenings. To magnify just how important it is to get screening, we brought in Colorado's Director of Advocacy for the American Lung Association, Mr. Nick Torres. How are you doing today, young man?
I'm doing well. Thanks for having me. Happy to speak with you today.
Yes, sir. I'm ready to get some of this truth out here in the world. So, Mr. Torres, I want to start with the root. What are some of the primary causes of lung cancer here in Colorado?
Yeah, thank you. So Colorado is doing well when it comes to things like low smoking rates, right? We're doing well in the nation. We know that tobacco use and smoking is the number one cause of lung cancer. So after generations of education, the public knows smoking causes lung cancer. So we can be happy to see Colorado on the right end of things there. Radon exposure is one that folks maybe not have heard of. And that is the number one cause of lung cancer for people who don't use tobacco, who don't smoke. And unfortunately, Colorado, because of our geography and the geology of our rock formations, has a lot of uranium deposits, has a lot of radon gas, and potential exposure for our residents here.
Yes, sir. That was one of the first things as a non-Coloradan resident that I learned and got hip to really quick. But Mr. Torres, what can we attribute to the low number of cancer screenings, lung cancer screenings?
I think this is somewhere where we certainly have a lot of room to make up across the country as well, not just here in Colorado, but we constantly see our rates for screening. Low dose CT scans are a life-saving tool, of course, when we go to detect lung cancer, but our screening rates tend to be pretty low. And here in Colorado, we're near the bottom of the rankings in the country. So I think what we can attribute that to is, for years, lung cancer has had a stigma attached to it. And so we can't talk about lung cancer without talking about the stigma of whether it's tobacco use or whether the low survival rates. And so I think people have not necessarily been eager to go and get screened if they're at high risk for lung cancer. But what we want to get out there, part of the success that we want to show is we're seeing better survival rates, more treatment options. We're encouraging people who are at high risk to get screened.
Now, Mr. Torres, speaking of some of those no, low numbers in Colorado that you're talking about, I saw that less than 30% of new lung cancer screenings are early detected. How can we help get that number up as a public?
That's a great question. We are hoping to really get that message out too, because the earlier we screen, the better outcomes, right? The higher rates of survival that we see. And so when it comes to early detection, we're seeing some improvements around the country, but here in Colorado, for example, Latino Coloradans, Asian American Coloradans see especially low early diagnosis rates. And so we see pockets of the population where, if we can encourage early screenings, we know that we have much better outcomes. And so part of that is encouraging people to take advantage of the tools that we have. For example, the Lung Association partnered with the Ad Council nationally on an awareness campaign. We have a new tool called savedbythescan.org, where anybody can go and check their risk factors and get connected with a screening center in their area.
Nice. That's wonderful. Mr. Torres, I got one more quick question before we get out of here. And we've been sort of getting on the negative about Colorado, but let's focus on one quick positive. I saw that Colorado is below the national average when it comes to new lung cases, which is a good thing for us. How can we help keep that number down?
Well, I think, one of the positive things about Colorado, of course, is folks love to get out and enjoy our outdoors. We have low smoking rates. We have much higher rates of people, exercising, everything that we know that will keep our lungs healthy. We know we have to continue investing in things like tobacco prevention so that our young Coloradans aren't getting attracted to tobacco products, which we know is a huge risk factor for lung cancer. We also want to see folks get their homes screened for radon, for example, so that we can keep those rates low. We have a great partnership where we can get lung cancer, or we can get radon testing kits out to folks around the country, get their house screened, and really make sure that we're attacking both of those risk factors for lung cancer.